Is it okay if I call you Sissy?
Yes, please.
Okay, because I'm sure you go by that, but
Yes.
I know it's not your name, but that's what you go by.
Yes.
Miss Sissy, I don't guess we need to give your whole name if this is gonna be kind of a little testimonial for Republic. I think I'll tell the world, I requested Sissy, not
Yes.
Sissy. I've got my daughter goes by Cece.
Right.
So
I get that too once
with
in a
my
while.
grandbaby, so I got a Sissy. I requested that she sit down with me and do a little testimonial, and she's been gracious enough to agree. We have treated a dozen or so. I wouldn't say we've treated hundreds, but we've treated a dozen or so patients for fibromyalgia with a simple nerve block that we do. She gained so much improvement that it just is so important, I think, to tell the world what kind of relief someone can get from a simple injection in a matter of minutes. And over the next day or two, you see that it's gone. It's just gone. But I don't want to sit here and talk. So I thought about this, is that if the world wants to hear it from Sissy's mouth, hear it from your story. So tell me, or tell the world, what was your life like prior to coming to Republic Pain? What was your life like? What was it on a daily basis?
On a daily basis, I had a pain level of between 8 and 10. I'm not kidding. It was, I would get up and I'd go to the bathroom and back into bed. This is the last flare-up I've had, and it's lasted since May, and I had the injection in October, and it was an 8 to 10 on an everyday basis. It was severe.
So when were you diagnosed with fibromyalgia?
In 91,
1991.
I had been sick since 92. I'd been sick since 1992. I was diagnosed in 2001.
Finally diagnosed in 2001.
Mm-hmm.
So that's 22 years, am I right? 22 years of living with fibromyalgia?
Yes.
What type therapies had they offered you over that time?
Like I said earlier, I was on everything from Tylenol to fentanyl. All the opioids you can think of. I had morphine injections at one point. Nothing worked.
I'm sure you tried gabapentin,
Yes.
Lyricas,
Yes.
antidepressants,
Yes.
Cymbaltas.
I'm still on Cymbalta because you have to wean off of it.
Wean off of it slowly.
Mm-hmm.
All the opioids. Now, if I remember right, you just got sick of the opioids and just stopped them.
Yes, and that landed me in the hospital in ER because I just quit taking them. I was so tired of taking them, and then they weren't working.
Yeah.
So it was just, I'll just stop taking them, and I ended up in ER in severe pain.
So we're just gonna say 20 plus years. Okay, so over 20 years you've been dealing with this, trying all the drugs, all the meds. Any holistic treatments? Did massage work?
I did that.
Acupuncture? Anything like that?
Acupuncture, acupressure. I had a certain vitamin regimen that I tried.
Yeah. Supplements?
Nothing worked.
Nothing was working?
No.
Okay.
Everything worked for maybe a week, and that was it. And then they'd increase the dosage.
Still no help.
Right.
Did you get diagnosed with any other autoimmune diseases? Chronic fatigue?
I did
IBS? Anything like that?
Chronic fatigue and IBS, I had those. And I say had because with the injection, they're gone. And that's a big deal for me.
Well, we're gonna get to that part. Obviously, I want you to tell what you feel like today. I don't remember actually of how you found us, Republic. How did you come to say, come to Republic Pain and say, what is this stellate ganglion block? What is this injection you do?
I didn't even know what you did. All I know is that someone, a nurse, an RN, suggested I come here.
Okay.
And when you've been sick for so long and you've tried everything, sure, I'll give it a shot. You know, that was my reaction. So I had no idea what was going on, what was going to happen. But for me, when you're so chronically ill, you will try anything.
Sadly, there's a big desperation that you'll try anything. So to tell the world what has made it, well, then tell them, what do you like today? Where you did October, what was our dates? Like mid-October.
Mid-October.
We're into December. We're between Christmas and I've lost count of the days. What is today? December 28th. December 28th. So we're 2 months, over 2 months out.
And I'm 2 months fibro-free. It was same day. I felt great that day, but the real test was waking up in the morning and taking a shower, because they were the most painful things I had to do. In the morning when I woke up, I almost always knew what my pain day would feel like the minute I opened my eyes. So the next day after the injection, I opened my eyes and it was like, okay, I'm waiting, nothing, zero. And I hopped out of bed, first time ever, in over 30 years actually.
Oh my gosh.
I was so excited. I wanted to go hiking. I wanted to go walking. I have literally, since May of this year till October, have been in bed.
Oh
I have
gosh.
not, I have traveled and had to take something so my husband would avoid bumps just so I wouldn't hurt.
Yeah.
So it was always a big deal going anywhere. So after the injection, I was just ready to go. I was ready to go. And it's been over 2 months and I have no symptoms. I have a light sensitivity still. I have a noise sensitivity still. But I'm fine. I'm great. I can't even say I'm great. I'm fantastic. I feel great.
So your pain's gone.
Yes.
What about that fatigue, that feeling of just being so tired? I know fibro patients there's a big overlap in chronic fatigue and
Right.
just if you do anything, this chronic, this post-exertional malaise, PEM, that attacks people, another autoimmune disease. How's your energy levels if you're able to get up and go? Now you're more active, you're able to get up and go do. Is that sustainable? Is that being sustained, or is that wiping you out the next day?
No, I am fine the next day. I remember in May, I was not even doing 100 steps a day, and now I do 2,000-3,000 steps a day. And I'm fine the next day. And one day that I only slept a few hours, I thought, okay, I should take a nap. So I lied down, I couldn't even sleep, I just wanted to get up. So it really made a huge difference in my life. And even my children look at me and they see me get up off a chair when before they had to help me get up.
Oh my gosh.
Yes, and so even my son saw me and he said, "Mom, you have a cheeky grin on your face." And I said, "That's joy." You know, I was happy. I was ready to get up and just do whatever. But I have to be careful still because I have been so, you know, just not able to do anything for so long. I'm so out of shape and I've gained weight. So I wish I could just get up and go do stuff, but I have to be very careful. You know, I'm not a spring chicken anymore, so I have to be careful.
Well, we talked about, so let me explain to people. I know, hopefully we got them hooked now. Hopefully we got them hooked that, oh my God, there's an answer to fibro.
Yes.
There's a simple answer to fibro,
without drugs.
At least for some people. I don't know how many it's going to be or how much success we're going to have when we start treating thousands, but we've done around 12. I think you're number 13. We have seen this same response out of every one of our patients. They go Fibro-Free, what we call Fibro-Free. Actually, you termed it. I just said they're pain-free, but we're gonna term it. We're gonna call it Sissy's terminology, Fibro-Free.
You're fibro-free.
And let me explain what this is for them, okay? Because I know I spent maybe an hour talking with you and your husband initially,
Yes.
and what I thought was going on with fibromyalgia. Fibromyalgia is an autoimmune disease,
Yes.
right? Autoimmune meaning your autonomic nervous system is triggering your immune system. That immune system is sending out inflammatory mediators throughout your body. That inflammation is where all the pain comes from, whether that's our joints, whether that's our muscles, our fascia, our headaches, our insomnias, all of these different symptoms, the IBS, the inflammation in our gut, our joint pains, muscle pains, headaches, fatigue, all this chronic fatigue, all of this stems from this vicious cycle of the autonomic system triggering our immune system, the immune system sending out inflammatory mediators. The more inflammatory mediators that are circulating through the body is another trigger to the autonomic system to re-trigger the immune system again. So the body stays in this vicious cycle of autonomic stimulation, sympathetic, fight or flight stimulation to be precise, immune system, inflammation. Sympathetic nervous system, immune, inflammation.
Right.
All the world has been treating is our symptoms. So if we hurt from the inflammatory mediators, we either give you narcotics, opioids, or we'll give you steroids, high-dose steroids, to block the inflammatory response in the body. In some cases, like rheumatoid arthritis, Crohn's, we'll actually give you the next level up, treating the immune system and immune blockers, or the immune suppressant drugs of Humira, Skyrizi, Enbrel, all of those type drugs, what we call the DMARDs, okay, that are blunting our immune response. If your immune system doesn't work well, then it won't send out all those inflammatory cells, and your symptoms seem to be a little better. But all we've done is really blunt your immune system, and it doesn't work well. Nobody is treating the initial insult or the trigger of the whole cycle, which is the autonomic nervous system. That is the trigger. That is where it all begins. And that autonomic nervous system is a part of our brain, the hypothalamus. It's part of the autonomic system. It has two components, a sympathetic and a parasympathetic system, that keep our body in what we call homeostasis, or balance. When we're in these autoimmune diseases, we're always in an elevated sympathetic state. We're always in too high a sympathetic state, a fight or flight response. That's producing all of these symptoms, at least in most of the autoimmune. I haven't had a chance to treat every autoimmune disease. There's 63 of them. I haven't treated them all. We discovered this for the world treating long COVID. Long COVID syndrome was something that's been very prevalent in the last 2-3 years. We started using the sympathetic nerve block, cervical sympathetic nerve block, to treat long COVID. We published on it once. We're in the midst of our second publication, treating long COVID with it. We're at 90% success rate, 88 to 90% successes, reducing the symptoms of long COVID with a sympathetic nerve block. What we noticed in treating 3,000 people for long COVID was many of them came in, probably at least 80% would come in, and they would have a history of having fibromyalgia, chronic fatigue, IBS, PTSD, chronic anxiety, depressions, all of the same symptoms.
All of the above.
Right. And when we treated them for long COVID with the sympathetic nerve block, not only did their long COVID symptoms go away, but all these autoimmune symptoms went away too. Really we saw it consistently enough as a kind of a secondary effect that we finally started treating some specifically just for these autoimmune diseases, fibromyalgia, chronic fatigue, IBS, PTSDs. It worked just as well. And I don't know that fibro is not working better than our long COVID patients that are at 90% success rate. So we're seeking to tell the world. We're trying to find a way to tell the world, and apparently social media reaches a lot of people. There's not a better advertisement than listening to Cece tell her story about what life was prior for 30 years, 20 plus years, and what it's like today. I'll be the first to tell you that there's no doubt you have some, what I call mechanical pains. There's some things that still hurt, that whether they're arthritis or they're degenerative joints, there's things that are not working well because of our age.
Right.
But the fibro pain, the chronic,
Gone. Zero.
it's gone.
Zero.
Okay.
And it's just fantastic to wake up and eager to do things, because that was not possible.
If this doesn't make you want to seek a solution, if that doesn't touch your heart, then you don't have a heart. So I just tell you, I beg you, give us a call, talk to us, Republic Pain Specialist, Bryan, Texas. Let us try and change your life. Give us a chance, okay? That's all I ask.
If I could do a cartwheel, I'd do it, but I can't. I feel fantastic, and it's been so many years that I've felt like that. I mean, it's unbelievable, and I'm so grateful.
Well, thank you.
So
We're gonna change the world, okay? We're gonna change the world. Let's do it, okay?